I'm Katie Podoretsky with Katie Massage, licensed massage therapist. Today I wanted to share with you how I approach prenatal massage as a structural massage therapist, show you the bolstering system that I use to support the body on the table. Prenatal massage has many benefits for both the mother and the baby. It can reduce stress, tension and anxiety, relieve muscle and joint pain, reduce swelling through the legs as we move the fluid up through the body, strengthen the immune system, and improve digestion. As a structural massage therapist, I have a strong anatomy background, so I like to do very detailed work for the low back and the hips to help the pain that pregnancy brings. So when women are pregnant, this growing baby takes up a lot more room through the abdominal cavity, the lower abdominal cavity. So as the baby grows, we have less room for our organs, our digestive organs, our reproductive organs, our urinary organs, and also then that baby and all of those other organs are pushing up into the diaphragm and into the lung area. Then we also have this just collapse through the torso that I see commonly. The lady's chest is growing, so it's adding this weight and curling around as well. So if we can increase the space of the abdominal muscles, and there's 4 of them, 2 oblique muscles, rectus abdominis and transverse abdominis. Think of transverse abdominis like a lovely girdle that holds in all of our guts into here. But if we can increase the length through there, then we can allow the ribs to lift up off of the pelvis. That'll give us more room for better digestion and better breathing space. So picture that this growing baby has a foot up underneath here. So it's pushing into the stomach. If we can give this more space, that foot can maybe drop out, or the belly can come out a little bit more naturally versus the baby trying to come up and hide up under the rib cage when you feel that baby coming up and kicking under the ribs. So with that also, once we can lift up this rib cage, we're going to have more room for the diaphragm to expand down and for the ribs to flare out to get that fuller breath in. So what women will experience from a breathing standpoint is fuller, deeper breaths. We'll be able to breathe into our side ribs. We'll be able to do a little bit more belly breathing, be out of breath slightly less, there will be more space under where the stomach sits to drop down versus being shoved back up. When we do drop that stomach back down, we get a few days of less acid reflux, if that is a problem. And I see that commonly in women, and when we do a lot of good belly work, lower rib work, we do get that results. So how that abdominal massage looks or feels is that on the actual belly where baby is growing, it is very light. We're not really overly lengthening the muscle bellies there. I like to target on the attachments. That's going to be on our pelvis, how it attaches throughout our pelvic crest and even onto the back side, and then the lower ribs where our rectus abdominis, but especially our obliques are attaching through here. So external oblique runs in this pattern and attaches up onto our side ribs here. There's a muscle called serratus anterior that is here. They interdigitate or merge. They both look like 2 serrated knives, sort of butt up next to each other. So external oblique, when it's too tight, it'll collapse us down through here. When serratus anterior is too tight, it'll bring that shoulder blade around, and we get into this sort of collapsed bit, and we can't get good breathing. So if we are, again, lengthening out the abdominals, giving a little bit more space, lifting the ribs off of the belly area, bringing that shoulder blade back, allowing the serratus anterior to do its job as well with breathing, it will expand the rib cage in inhalation when you're breathing in, so we'll have more potential for space. We're also no longer doing neck breathing, so we can get those neck muscles freed up. It goes hand in hand. Let me now show you the device that I use for bolstering. This device is called the body cushion. We can use it sideline so that we can position that body. And if you look at this picture, you'll see that my client's spine is still straight. She's not bolstered with cheap pillows where she's rolling forward and those pillows are not doing a great job of holding her. Here with this body cushion, it's very firm and it holds her so that she doesn't have to stabilize her body when I'm on the back, massaging the back and sort of pushing forward into her torso. So she's not having to grip and fight. And so that she can actually relax and enjoy the session, and we can do our best body work and not create irritation someplace else. Also, look at this great leg cushion. It positions that hip at a wonderful position so that the hip isn't curling forward, starting a rotation in the lumbar vertebrae and then heading up the spine. Again, when I want to work that upper hip, it gives me something good and solid to push against so she's not gripping and fighting against me. I like to bring some attention to where that upper arm drops in between the two cushions so that, again, that client doesn't have to grip or figure out how to balance on that lower shoulder because most of our session is done in sideline. The client also feels that that shoulder isn't crammed up into the shoulder joint and further irritating it. They sleep on their side every night. One of the things that pregnant women complain a lot about when they're sleeping is that cramming up of that shoulder and just being tired of that. So let's make it comfortable. The second way that we use this is for a semi-reclined position. So I just get to rearrange the two cushions, put extra bolsters and pillows underneath the lower leg, and that allows that client to be in a semi-reclined position. So that way we can work into the abdominal area. In the last few weeks of pregnancy, I like to educate my clients on what I call tips and tricks for your muscular and skeletal health as you prepare for birth and the many tired days and nights of breastfeeding that are probably ahead of you. So in this, we talk about how to prepare your body for birth, of what specifically you need for your own body, but also of how to best position yourself so that you can be your most successful self when you are breastfeeding, bringing baby up to you, not you down to the baby, adjusting footstools, pillows in the low back, what supplies do you need to have at your house so that you're ready to go. How important is it to drink water during this stage? All of these wonderful little things that I've collected that are pertinent to the muscle and skeletal health that I normally treat. So I hope this video gave you some insight onto how I think through and treat my pregnant clients. If you yourself need a little bit of work in this, or if you know someone else who could use my support during that time, go ahead and send them my way. My website is www.katiemassage, and I look forward to seeing any of you soon. Thank you.